Okay, this is the muscles, Chapter 10. This is going into Part 2. There's only going to be 2 recordings on this one. This one, of course, I want to let you know, of course, the first 4 pictures here are going to be some of the things you need to label, of course, on the Muscle Man model. You need to, well, highlight these. The ones I highlighted are the ones you need to be able to label. Now, on your Mastering AP quiz, they may have you actual label a little bit more, but that one is open book. The quizzes are, and it's not timed. But test-wise, I'm going to ask you to identify specific ones. So one of those would be the temporalis orbicularis oris, trapezius, external oblique, the intercostals, and there's our internal and external, internal oblique, rectus abdominis, sartorius, the quadriceps femoris. On this picture, they're adding those together, but you will need to know those separate, which I'll give them to you separate in another slide later on. And I think the next picture shows them to them separate. Gastrocnemius, the soleus, tibialis anterior, adductor, the adductor muscles of the thigh. Again, I'll give you those as separate as well too. They're talking about those as a group. The abdominal aponeurosis. Um, okay, you do not need to know that one or that one. Okay, so I'm going to mark those off. Um, you do need a brachioradialis, biceps brachialis, serratus anterior, pectoralis major, deltoid, sternocleidomastoid, masseter, and orbicularis oculi. Okay, and you do not need to know this, the longest muscle. Okay, so this is the picture out of our new lecture book. I just want to go over this one because, again, on all these muscles I'm telling you to be able to label, we're going to go over them on the next few slides individually with the actions. But this lecture book is a little bit different than others. So they talk about the axial muscles and the appendicular muscles. There's actually, the human body has approximately 700 muscles. Okay, we're not going to make you memorize 700 muscles, so we've cut that down dramatically to about, I think, maybe around 60. Um, but the muscles that arise, of course, on the axial skeleton, these muscles are going to position the head like the spinal column, move the rib cage, assist in movements that make the breathing possible, just like with the bones when we talked about the axial skeleton and the bones. The appendicular muscles, these are going to stabilize or move the appendicular skeleton, so this is referring to the appendages, or what's moving the appendages. Okay, so you do need to know the temporalis. This book, also, I need to clarify this because it has 2 names. The frontalis muscle, which is the muscle up here in the front forehead, on the forehead. This lecture book or this author calls it the frontal belly. Okay. Other lecture books in your lab manual may call it the frontalis. So both are correct. So be familiar with both of them. So frontal belly, sternocleidomastoid you have to know, rectus abdominis, external oblique. You do need to know the line here, which is the linea alba. Patella, of course, tibia bone showing, so they're putting it on there. Trapezius, clavicle, sternum, deltoid, pectoralis major, serratus anterior, latissimus dorsi, biceps brachii, triceps brachii, brachialis, pronator teres, brachioradialis. You need to know gluteus medius, tensor fasciae latae, known as your TFL, adductor longus, that's one of the adductor muscles, the gracilis, sartorius, rectus femoris, vastus lateralis, vastus medialis, gastrocnemius, tibialis anterior, and solus. Okay, those are the ones you have to know. The ones I did not highlight, you do not need to know for the test, but for your quiz, they may have those on there, but your quiz is open notes, open book, so. Okay, so this is the posterior side. You do need to know, of course, the epicranial aponeurosis. That's the aponeurosis, of course, on the skull that touches the occipital belly to the frontal belly. Sternocleidomastoid, trapezius, deltoid, triceps brachii, olecranon of the ulna, just showing you your elbow. Gluteus medius. Make sure you know the Achilles tendon. Um, that is the tendon here that attaches your gastrocnemius muscle to the calcaneal bone. So this book, this is a picture from a different source. Your new lecture book calls the Achilles tendon the calcaneus tendon. Both are the same thing, so make sure that you know both names with that. Gastrocnemius, the hamstring group, um, biceps femoris, semitendinosus, semimembranosus, gluteus, sorry about that, gluteus maximus, latissimus dorsi, teres major, teres minor. For this one, again, this is showing you the axial muscles and the appendicular muscles that you need to know from the posterior view. This is showing you, of course, the occipital belly, the occipital frontalis, your sternocleidomastoid, make sure you can name it external oblique, solus, gastrocnemius, sartorius, biceps femoris, gracilis, semitendinosus, membranosus tendinosus, adductor magnus, gluteus maximus, the TFL, gluteus medius, brachioradialis, latissimus dorsi, triceps brachii, just know it together, teres major, teres minor, infraspinatus, deltoid, and trapezius. So on this picture, that's what you would need to be able to view or label. So checkpoint here, so we talked about the axial and the appendicular muscles. So what I may ask you on your quiz and your test to name or identify which, like if I'll give you a muscle, you have to tell me, is it in the axial muscular system or skeletal, or is it in the appendicular or the axial? Okay, so the biceps brachii, I mean, just think about this first, pause it if you want to. Then I'm going to obviously go over the answers. But biceps brachii, that would be part of the appendicular muscular system. Or skeletal system. External oblique will be axial, temporalis will be axial, and vastus medialis, it's on the leg, so that would be the appendicular. Again, there's 4 axial groups of muscles that stabilize the position of the head, neck, and the trunk. So you have muscles of the head and the neck, muscles of the vertebral column, oblique and rectus muscles of the trunk, and muscles of the pelvic floor. Okay, so again, be able to label from a side view of a picture the muscles, and of course, all these muscles that we talk about, of course, over here, or fair game, like orbicularis oculi, that is the muscle here that is around the eye. Orbicularis oris, this is the muscle here that is around the mouth. Okay, so both these, if you notice, start with the name orbicularis, and it's because it is a circular muscle. They're enclosed in an orifice or an opening. So the orbicularis oculi closes the eyelids, blinking and squinting. It, of course, attaches to the origin is like the frontal bone, the maxilla bone, and the insertion area would be the eyelids. Orbicularis oris, that one, of course, the origin is maxilla and the mandible. The insertion would be the lip area, the lips. So this one's the orbicularis oris is going to close and pucker the lips. And then, of course, it's known as your kissing muscle. It and again, just as another review, orbicularis circular muscle means it has a sphincter action, so it's going to decrease the size of an opening. So those are surrounding the opening areas. Next, we have your buccinator muscle. That is the muscle here, and I'm trying to find an ink here that show up on this thing. I apologize. So this right here is your buccinator muscle. Okay, that muscle, of course, compresses the wall of the cheeks when air is blown out. The origin would be like the mandible and the maxilla bone. The insertion would be the orbicularis oris. The zygomaticus muscle. Oh, okay, that one is actually have a major and a minor, but you just have to know the two, of course, as zygomaticus. What it does is it draws the angle of the mouth upward and outward, and it gives you the features of smiling and being able to laugh, or that expression of laughing. So the origin is the zygomatic bone. So this is an easy one to put down as an example because it's named after the bone that, of course, the origin is attached to. The origin of the muscle is attached to it. So the origin is the zygomatic bone, and the insertion is the orbicularis oris. Another thing to remember, buccinator. There's a term called buccal, B-U-C-C-A-L. Some people pronounce it buckle. It refers, of course, to the buccal space in the mouth. That's usually between the cheek and, of course, the gums. So specifically the cheek area. So if that helps you to remember that one. Okay, next we have your temporalis muscle. Okay, that is here. The temporalis, of course, raises your mandible. The origin of it would be, of course, where it's located at the temporal bone. So that's another easy one. But it does go down and attaches, of course, to that coronoid process of the mandible. So that would be the insertion. Masseter muscle, that one is here. The masseter muscle, of course, make sure that you remember that it is your primary chewing muscle. And it's also known as your muscle of mastication. So it's going to raise the mandible up and down. The origin of it is your zygomatic arch, which I'll show you a picture where you can see it a little bit more detailed on the next picture. And the insertion is the ramus of the mandible. So in this picture here, you can see that the main chewing muscle, which is the masseter, it comes up here and it attaches, of course, to that zygomatic arch. And you can see it come down here and attaches to the ramus at a little bit of the angle, of course, of that mandibular bone. Again, we have a few AP Flicks videos that I've inserted into the PowerPoint that when I have in-class students, I play these for my in-class students during class time. These are all in your Mastering AP, and they will be called AP Flicks. So for some reason, I cannot play them with this software that I'm using to record with. So you could go into your Mastering AP and watch those. Muscle groups of the head or scalp muscles. You have your, of course, the frontalis. This one's also called the frontal belly. So make sure that you put that on there. Frontalis also known as your frontal belly. Occipital talus is also known as your occipital belly because the new lecture book calls it the occipitofrontalis muscle and is separated by the epicranial epineurosis tendon. So frontalis, of course, the origin of it would be, of course, epineurosis, and then the insertion is attached to soft tissue beneath the eyebrows. So that it, of course, elevation of the eyebrows, and of course, it causes wrinkling of the forehead. Occipital talus is moving or pulls the scalp backwards. So occipital bone and temporal bone is where it originates, and the insertion would be epineurosis. So this is a picture here that's showing you, of course, the occipital belly, your frontal belly, and of course the epineurosis, the epicranial epineurosis right there. But this also shows you I showed you earlier, the zygomaticus. That one picture showed them two of them as one name, but it is actually two, a minor and a major, but we just have you know it as your zygomaticus muscle. Okay. Again, the buccinator, of course, is going to be the cheek inside here. Orbicularis oris is, of course, around the mouth. The mentalis, of course, is this one right here. So make sure that you can label that one. I don't have it on the notes, but you make sure you can label the mentalis there. And again, make sure you can name several of these muscles from a picture, and this could be a picture that is on there. So epicranial epineurosis on top, frontal belly, temporalis, masseter, buccinator or buccinator, of course, clavicle, thyroid cartilage. Make sure you can label that. The platysma muscle is a large muscle that covers all the smaller neck muscles. So that's why when we went over in lab the muscle videos of the Muscle Man model, we don't have that platysma on that model because we're showing you the other smaller muscles underneath. So the platysma, of course, does cover all of these. It's showing it to you just on one side. Orbicularis oris, make sure you can label that, and label the zygomaticus, the nasalus orbicularis oculi. Also, too, before I go to the next slide, if you notice, you see the platysma, of course, just on this side. That's because a lot of the models and pictures, your muscles are in layers, several layers. So what they do is, of course, they'll have the outer layer usually on one side, and then if you peel that layer off of muscle, this is what you would see underneath it. Okay. And just like that, also, mostly they'll show you that on the head and the chest, those layers on two different sides. So our models that we have in lab will do the same as well too. So next you have here the eye muscles. You have 6 eye muscles. The actions are going to be according to how they position the eye. Again, make sure that you can, of course, label these. And I have several different pictures here I'll show you. But this side here is showing you, of course, the lateral side. So this is going to be the lateral rectus. Up here would be superior rectus. Underneath would be inferior rectus. The ones on the side moving in a sideways position, that's inferior oblique. Again, on this side, this is the medial side of the eye. So this shows you the medial rectus. This picture, of course, shows them to you a little bit better position. So this is the anterior view of the right eye. It shows, of course, the direction of the eye movements that are going to be produced by these arrows by contraction of each eye muscle operating independently. Okay, so anytime you hear a rectus muscle, it's a muscle kind of that's going straight back or straight down. Okay, so superior rectus is named after the position. It says superior. This would be lateral rectus because it's going straight back. Medial rectus is going straight back. Inferior rectus is going straight back. It's on the bottom. Okay. The ones on the sides are both going to have the second name oblique. This is going down to the bottom, so that's inferior oblique. This is going around the top, so this is superior oblique. Okay, here are the actions that you need to know. These are pretty obvious because if you're looking down, or if you have a looking down, it's going to be the inferior rectus muscle that's functioning. Eye looks medially, you have medial rectus. Eye looks superiorly, superior rectus. Eye looks lateral rectus. Now the obliques are a little bit different. Both eyes are going to roll. Inferior is going to do the opposite, look superior and lateral, and where superior is going to look inferior and lateral. This is just an outline of what we're going to go through on the next slide, showing you the muscles of the neck. Some characteristics of these muscles of the neck are kind of ribbon-like. They extend up, down, or obliquely. They extend in several layers in a complex manner. So this is kind of an outline of the muscles we're going to go over. Sternocleidomastoid. This one, of course, moves the head forward and down. And again, this is another easy one to remember for the origin and insertion because it's named after that. Its origin is going to be the sternum. That's how it gets its stern name. Clado for the clavicle. So the origin is going to be the sternum and the clavicle. And the insertion is the mastoid bone or process that's on the skull. So that's how it gets its name, is the origin insertion of that muscle. So that one's an easy one to remember as an example. Moves head forward and downward. Again, that is the muscle here. That's the sternocleidomastoid. And these are all labeled on another slide for you, so you don't have to label them unless you want to. Sternohyoid. This one, of course, draws the hyoid bone downward. Again, the origin is going to be, of course, the sternum, but also, of course, the clavicle. And then the insertion would be the hyoid bone. Okay. This one, of course, is the sternohyoid. That's this one right here. You see it attaching up here. Again, this is showing you, if you put little dotted lines here, this is showing you the outer layer, and this is showing you the inner layer here. So what they've done is they've cut that sternohyoid muscle off, and underneath it, you have the not right there, sorry, down here. Underneath it, you have this one right here, the sternothyroid. So that draws the thyroid, of course, cartilage downward. And again, the origin would be the sternum, the insertion of that one is going to be at the thyroid cartilage. So all of these, I tell students these are good examples to, if I ask for an example of or tell me about an origin insertion of a muscle, you could pick one and kind of give me some examples. Mylohyoid, this one of course elevates the floor of the mouth to swallow. The mandible is, of course, the origin of it, and of course the insertion will be the hyoid bone. So it elevates your hyoid bone or depresses the mandible as well too. The mylohyoid muscle, that's the one that goes across here. On here, this is showing you, of course, all those that I just had you label on the previous slide. But you need to be able to label the sternocleidomastoid. I already showed you that one. The sternohyoid, the sternothyroid, and the hyoid bone. Your mylohyoid, that's the one going underneath across, transverse across underneath the chin. Make sure you can label the mandible. And of course the masters on this picture here. One that you need to add to your notes is your digastricus muscle. The digastricus muscle is this one right here. It has anterior and posterior, kind of goes across. Okay, so it's an anterior belly and a posterior belly. But make sure that you add that what the function or the action of the digastricus is, that it raises the hyoid bone and lowers the mandible. Okay, the platysma, also add the platysma muscle to your actions. Remember, it is that, it doesn't show it on this picture, but the platysma is that muscle that covers all these smaller muscles. So it depresses the mandible and it makes the lower lip move backward and upward. Here, of course, is another picture. I like to show different pictures because different books can kind of give a little bit different views. So what you need to be able to label is the mylohyoid again. Again, these are repeated a lot because I've just given them to you on the different pictures. The sternohyoid, sternocleidomastoid, and your mylohyoid and the digastricus. Okay, so what I usually do with the students in class is I have them kind of try to label this picture. So if you want to pause this, you could do that and try to label it. But pause it, and I'm just going to go over the answers. And what I'm going to do is I'm putting the first letter of the name of the muscle on it. So this one right here, of course, would be T for temporalis. This is your epicranial aponeurosis, so EA. This is your frontalis, or your frontal belly. The occipital belly is back here, or your occipital talus is not showing on this model or picture. This one here with the eyes, that's your orbicularis oculi. The nose would be the nasalis. You have, of course, one around the mouth, that's your orbicularis oris. This up here was the oculi. Okay. Next, this one, of course, is the buccinator. This muscle here is your masseter. This one here is your sternocleidomastoid. I abbreviate that SCM. The back of the neck and the upper part of the back is going to be your trapezius muscle. So from this view, those are some of the muscles that you could actually identify on the picture. So name the muscles, of course, that will be associated with the mouth. Of course, there's actually several. Actually, there's 9 muscles that are associated with the mouth, but name the ones that we've talked about. So the ones we've talked about would be the buccinator muscle, the mentalis muscle, and the zygomaticus, and the orbicularis oris. So those are 4, of course, that we've already talked about. They are, I guess, like I said earlier, a lot of them, but some of them we don't have you know or identify. Identify the muscle, of course, that's involved in whistling. That can be the buccinator, and also, of course, the orbicularis oris. State whether the following muscles involve the mouth, eye, nose, ear, scalp, or neck. Again, pause this, see if you can quiz yourself, and then unpause it, and I'm going to go over the answers. So the buccinator would be the mouth. The mentalis would be the mouth. It's associated with the mouth area. or with the actions of, the nasalis is the nose, the platysma would be the neck, orbicularis oris would be the mouth. I'm just putting in for mouth. And again, the platysma, I already did that twice, so that would be the neck. Explain how a person is able to consciously move the skin on the scalp, but is not able to consciously move the skin, of course, on your thigh. And that's because a person is actually able to consciously move the skin on the scalp because what it is the muscle fibers of the epimysium, of course, are woven or moved into of course, the subcutaneous layer in the dermis, whereas the muscle fibers on the thigh insert into the bone and tendons, not the skin tissue. Uh, Bell's palsy, that's a unilateral paralysis of the muscles of the facial expression. So the person has the inability, of course, to control facial muscles on the affected side. The facial nerve 7 is what is damaged. But they say there's no specific cause that can be identified with Bell's palsy. It is thought that maybe it's a reaction due to like the inflammatory condition that leads to swelling of that facial nerve. Usually gets better, of course, on its own over time. Strabismus, this is also known as cross-eyes, or it is a condition in which two of the eyeballs are not properly aligned. So they say that strabismus, of course, can be hereditary. It can be due to birth injuries. It could just be due to poor attachments of the eye muscles. Problems can be in the control center of the brain, can cause it, and there's certain localized diseases they say can cause it as well too. Number 7, if you're contracting and relaxing the masseter muscle, what would you probably be doing? And that means you would be chewing and eating if you were moving the masseter muscle, contracting it. Position in the shoulder, move of the arms, and move of the forearm and the hand, or the muscles of the upper extremities actions. This right here is the outline of the muscles we're going to go over on the next few slides. Pectoralis major, of course, again, this is one of those pictures that I told you about earlier. If you draw a little dotted line through the middle here. Okay, if you draw like a pretend line down the middle here, this is on this side is going to be the external layer. And this over here are going to be your internal layer. And they even have this one done a little bit further inward because there's several layers. Okay. So your pectoralis major, of course, is shown on this side. That's your chest muscle. It pulls the arm, of course, across the chest. It actually attaches the origin of it attaches to like the clavicle, the sternum, coastal cartilages. Insertion is in the humerus because that's how it pulls the arm, of course, across the chest. Pectoralis minor is underneath the pectoralis major. You can't see it on this picture because they've taken it down even further in the layers. So it attaches to ribs 3, 4, and 5. It draws the scapula, of course, forward. Serratus anterior, that, of course, is this muscle here that is attaching, of course, to ribs 1 through 9. And it pulls the scapula downward, forward, of course, and inward. But you can see the serratus anterior on this side. And then when you go deeper down, you can actually see it attaching to the actual ribs. So muscles, of course, that position the pectoral girdle that we talk about are going to be like the pectoralis minor, serratus anterior, the trapezius, and there's, of course, 4 others, but those are the 3 we talk about. So trapezius is one that you need to know. Again, that's going to be the back of the neck, and also on the, it's like what they call a diamond-shaped muscle, and on the upper part of the back as well, too. So your trapezius, of course, that adducts and elevates the scapula, pulls, of course, the head backwards. The latissimus dorsi, that is and the trapezius, of course, that's what people call the traps. Again, that's going to be on the back of the neck and, of course, on the upper back. Latissimus dorsi, that is the large back muscle in the lower back. It extends, of course, and adducts, rotates the arm medially, pulls the shoulder downward and backward. This right here gives you a picture, of course, of that trapezius muscle, what they call diamond shaped. Again, that would be on both sides, but they've taken this layer off to show the underlying layer. But the trapezius muscle, of course, is also known as your traps. You can also see the serratus anterior from this angle as well, too, because they have those other layers off. Again, you could go back into your Mastering AP to watch the AP flicks. What it does, it just shows you that muscle in action, and it talks about the insertion and origin a lot on each one. Coracobrachialis, that's the flexion, causes flexion, adduction of the upper arm. Again, it gets its name because what it attaches to. So coracoid, so it attaches to the coracoid process of the scapula, so that's the origin. And then, of course, the insertion is, of course, the humerus, where your brachialis muscle is. Your deltoid, of course, that insertion, it inserts, of course, on the deltoid tuberosity on that humerus. But the deltoid muscle, of course, is going to be known as your shoulder muscle. That's over here. And it causes abduction and extension, of course, of that upper arm. And, of course, the coracobrachialis, you can see a little bit of it right here on this picture as well, too. Okay, next we have the back. What they've done here is they've taken off that deltoid muscle, so underneath it, you see, of course, these muscles are all going to be in, most of them are going to be in the fossas on the scapula. So the supraspinatus muscle is going to be, if you remember, here's your spine of your scapula, and the supraspinatus fossa was above it. So it's your supraspinatus is right there. The infraspinatus will be below. Then you have right below it, of course, is the teres minor, and then the teres major. Okay. On the other side, the anterior side, you have the subscapularis, and that's going to be the muscles in the subscapular fossa of that scapula. So it rotates the arm medially. But the muscles, I think I'll give it to you on the next slide, of these muscles, of course, 4 of these muscles are going to be called what they refer to as a group called the rotator cuff. So the rotator cuff, of course, rotates a bone around its longitudinal axis. So that's a common name for 4 muscles that's associated with the tendons, and they're involved in the arm movement, such as throwing a ball. Often people who play sports such as football and baseball, they overuse that muscle a lot, so sometimes they can get it injured. But you have here the supraspinatus, the infraspinatus, teres minor, and the subscapularis muscle is all going to be your rotator cuff muscles. They use the acronym SITS to help you to remember that. So the acronym SITS is going to represent the first letter of each muscle, and it can help you to remember the names of the muscles. Okay, I'm going to go back a slide because I forgot to tell you, of course, that all of these muscles here, all 5 of these muscles, they have the same origin, and that's going to be the fossas of the scapula. So they all have the same origin, and that's going to be the fossas of the scapula. Now these 2 here, the supraspinatus and the infraspinatus, they insert on that greater tubercle. Okay, insertion. These 3 have an insertion of the lesser tubercle of that humerus. Again, when you get a chance, you can play these videos. This is an outline of the muscles we're going to go over, of course, that move the forearm. But just remember, like triceps, tri means 3, it has 3 heads, bi means it has 2 heads. If it was quads, it would say 4. So also to move the hand, we're going to talk about the supinator, pronator, teres. So the biceps brachii, that is the flexion of the forearm. It rotates, of course, the radius outward to supinate the hand. And of course, your biceps brachii, of course, is what we refer to as our biceps muscle. The brachialis muscle is that muscle that is directly underneath that biceps brachii. So it also allows flexion, of course, of the forearm. Brachioradialis That, of course, is this muscle here. It causes flexion, of course, of the forearm. Again, it actually attaches, the origin of that actually attaches onto the humerus, and the insertion of it attaches to the radius. Next, you have your triceps. So this is the anterior view of your hand. This is, of course, the back of the hand. So this is the back of the arm. So that would be your triceps brachii, also known as your triceps. And what it does is it helps to helps with the extension of the forearm. But you can see where it comes down here and inserts, of course, on that olecranon process. And of course, it's going to originate on the humerus. Supinator and pronator teres. Again, these are two muscles that kind of crisscross slightly. Pronator is going to be the one on top, or is what I call the one on top. And supinator is the one, of course, underneath, or it crosses it underneath a little bit. And I always tell people always get these two mixed up a little bit on the test. So what I tell them is P comes before S in the alphabet, so the pronator teres will be on top. Okay, so make sure that you, of course, can label those along with the biceps brachii, the biceps brachialis, and the brachioradialis. Both the supinator and the pronator teres is going to both originate, of course, on the humerus and insert on the radius. Pronator teres, of course, is going to rotate the arm medially. The pronator teres, you have that pronator action. So what it's going to do is going to turn the palm inferiorly or posteriorly. So you see with the pronator teres, you're going to see, if you're staying in the anatomical position, you would be looking at the back of the hand. Whereas the supinator, and it shows you here with the supination thing, you see the palm of the hand. So this would be the palm, because that supinator is going to rotate the arm laterally. And of course, pronation, the hand, of course, is going to go towards medially towards the body. So that's going to put it where you see in the back of the hand. So if you can look through these videos online as well too. So I'm just flipping through them real quickly. Next, you have your carpal tunnel syndrome. These are caused by inflammation of the flexor reticulum and the synovial tendon sheaths. The synovial tendon sheaths are here on the picture showing to you. This is showing you cross section of the wrist. Okay, so those synovial tendon sheaths, or what they are, is just tubular bursae. Of course, that surround the tendons where they cross bony surfaces. So what it is, they restrict when they're, it causes them to be inflamed. And when they become inflamed, of course, it irritates, of course, that medium nerve. So it restricts the movement, puts pressure on that medium nerve, it causes tingling, numbness, weakness, and pain, of course, in the wrist and the hand. Your breathing muscles, of course, and your abdominal muscles are the ones that we make of course, of the trunk. Your diaphragm muscle, of course, this one, of course, is about 75% of your breathing comes from those muscle actions, and 25% of your breathing comes from the action of your intercostal muscles. And the intercostal muscles are going to be internal and external. On your picture here, it shows you the internal intercostals and both the external intercostals are in between those ribs. What it is the internal intercostals are more inward, and the external intercostals are a little bit on top of that one, but they're not showing, of course, on this picture. The diaphragm also, remember, is going to pull the central tendon down during, of course, your inspiration of breathing. It separates, remember, your thoracic cavity from your abdominal cavity. And of course, it's a dome-shaped muscle. So when you exhale, your diaphragm is going to be dome-shaped. When you inhale, it's going to be flat. The intercostals, what they do is they lower and elevate the rib cage. Again, you can watch these videos on your Mastering AP site. What muscle is most important in breathing? And that's going to be your diaphragm muscle, because it's going to provide, the action of that muscle is going to provide about 75% of your breathing. That's supposed to be not doom, it's supposed to be dome shape. So when a diaphragm is dome-shaped, you are going to be exhaling. When the diaphragm is flat, you're going to be inhaling. Again, muscles of the abdominal area that we'll go over is like your external oblique, internal oblique, transverse abdominis, and your rectus abdominis. Your external oblique, of course, compresses the abdominal area. The internal oblique, and again, you have to be able to label these external, and this is again two different layers. This is the external layer, and then this is the internal layer. So you have your external oblique. On the other side, you're going to have your internal oblique. Okay, make sure you can label both of those. Transverse abdominis usually is the deepest. This is going to be the deepest layer. So it is not showing on this picture, but if it did, you would see that, of course, it runs transverse. So it compresses the abdominal wall too. So all of these have the same action. They're all three going to compress the abdominal area. Your rectus abdominis, of course, is going to be, it's not showing on here, but it is it's right here. It's the red part here that's moving up and down, this muscle here. So the rectus abdominis muscle, that's the one that forms, of course, your six-pack, or what they call your six-pack muscle. What structural feature gives strength, of course, to the muscles of the abdominal wall? And of course, that's going to be, of course, your abdominal aponeurosis. Of course, that's here. And it's just a really strong membrane structure. Again, we're going to just flip through those videos. And you could watch those later on Mastering AP. So muscles, of course, of the lower extremities, of course, they're going to be among the longest and the strongest in the body. They specialize for locomotion and balance. The ones we're going to go over are some of them are going to be gluteus maximus, medius, adductor, sartorius, and hamstrings. So first, of course, you have here the muscles that move the thigh or the leg. That's going to be your gluteus maximus and your medius. Gluteus medius is where you have your intramuscular injection. Of course, usually goes into the gluteus medius muscle. Make sure that you can label that. You have your gluteus maximus is going to be more on the outside, and it is larger. Medius is under it, and minimus is underneath, of course, the medius. Again, you just need to be able to label these. This is showing you, of course, the maximus here and the medius part of it here, and then the rest is underneath the maximus. Again, you can watch those videos later. Adductors, of course, you have the adductor muscles. That's, of course, going to be your adductor group is going to be your adductor magnus, your adductor longus. So you do need to know those, adductor longus, adductor magnus, and, of course, your gracilis muscle, the ones I have you know in lab. But there are two more muscles that are considered adductors, but those are the three that we have you know. So the adductors are going to adduct, or it calls adduction and flexion, medial lateral rotation of the femur. The sartorius, that is the muscle that kind of goes across all these muscles, and it flexes the lower leg and the thigh, rotates the thigh laterally and leg medially. Over here, of course, these are known as your quadriceps muscles. The rectus femoris is in the front, and then you have a muscle on each side and one underneath that. So the one underneath the rectus femoris is going to be the vastus intermedius. So it's underneath, under the rectus femoris. Okay. The vastus medialis will be the one on the medial side. The vastus lateralis will be the muscle on the lateral side of the leg. Okay, so if you notice that all of these are going to extend the lower leg. Okay, but the rectus femoris also helps with a little bit of flexion of the thigh. So all four of these have the same insertion, and that's going to be on the tibia bone. But the rectus femoris and the vastus lateral, the rectus femoris has the origin of the ilium, and the other three vastus muscles, they originate, of course, on the femur. Your hamstring muscles, that is a hamstring group. That's going to be your biceps femoris, your semitendinosus, your semimembranosus. So if you notice here, they all are going to flex the calf, and they're all going to extend and rotate to the thigh. So they all have the same action. Of course, all of these are going to originate, of course, on that ischial tuberosity, and they all are going to insert, of course, on somewhere on the tibia. If you look here at the picture, you have your biceps femoris muscle. The biceps femoris muscle is going to be on the lateral side of the leg. So I always tell people to remember that because these are a couple that the students usually get confused. The semitendinosus and semimembranosus. You have, of course, your tendinosus, of course, be here, and your semimembranosus is underneath it, and you can see it a little bit on each side. So you see it kind of underneath it, but it's showing a little bit on each side underneath, of course, that semitendinosus. Again, this is just showing you a different view of the leg on the anterior view, showing you, of course, that rectus femoris, the vastus muscles. Yeah, you do need to be able to label, of course, the TFL, which is going to be on the latter part of the leg, the adductor longus, gracilis, sartorius, quadriceps tendon as part of your knee joint. This is the back showing you the hamstrings, which are going to cause the flexion of the leg. So you remember you have the biceps femoris you need to be able to identify on the picture, and your semitendinosus, semimembranosus. Also from this view of this picture, you can label the gluteus maximus, the TFL, and the gluteus medius muscle. Again, just go through those videos when you have time. So muscles that move the foot that we're going to talk about are the gastrocnemius muscle, your Achilles tendon, also known as your calcaneal tendon, soleus, and your tibialis anterior. So the largest muscles that are associated with your ankle movement are going to be like your gastrocnemius and the soleus muscle. So that's why we put those two on the slide together. What they do is they produce your ankle extension. So your gastrocnemius, of course, is what we refer to as your calf muscle. It allows you to have plantar flexion, and also soleus does too. And soleus is the muscle located behind your gastrocnemius, and it's underneath the gastrocnemius, and you can see a little bit on each side come out here of that soleus. Both the the gastrocnemius, of course, the origin is the femur, and again, it attaches down here to the calcaneal bone with help of the Achilles tendon. The soleus, the origin of it is the fibula and the tibia, and it inserts as well as the calcaneal bone, which is your heel bone, by the Achilles tendon. So your gastrocnemius and your soleus muscle, along with your Achilles tendon, because that's the tendon that is attached to the gastrocnemius calcaneus. Remember, some books will call the Achilles tendon your calcaneal tendon. So these muscles are going to be essential for walking and running. So if you was to tear the calcaneal tendon, or also known as your Achilles tendon, how would that affect the movement? So a torn calcaneal tendon would make extension of that plantar flexion, going up on your toes, at the ankle difficult, because this tendon, of course, is going to attach the soleus and the gastrocnemius to the calcaneal bone, which is the heel bone. Tibialis anterior is here on the front. That's just this muscle here. And this is your tibia bone, so it runs right beside that tibial bone. It also originates on the tibia bone. It inserts, of course, on your tarsal bone. The tarsal bone, of course, inserts on, I think, is the cuneiform bone. So it causes dorsiflexion and allows you to move your foot inward, which is the inversion of the foot. This one right here, of course, is showing you, again, a picture of that gastrocnemius muscle. Soleus muscle, remember, it's underneath the gastrocnemius muscle. So this picture here, what they did, they've cut the gastrocnemius muscle off, so underneath it you're able to see the whole soleus muscle. Next, you have your tibialis posterior, which you need to add to your notes. The action, of course, of the tibialis posterior is going to be plantar flexion as well. Okay, so it also originates on the tibia and it starts on, of course, on a tarsal bone. So a few things, beginning of course with the age 40, you usually have a gradual loss of muscle cells, loss of power, tendency to flex hips and knees, and you can have a decrease in the height as well too. So that is the end of part 2 and the end of chapter 10.